Mrs. Z, a widow of 15 years, living alone, was reaching for something on a top cupboard, turned too fast, fell hitting her hip, and couldn't get up by herself. She lay on that cold linoleum floor for most of the night until she was finally able to crawl to a phone and call for help. In the emergency room, we saw the telltale signs of an outward turned and shortened leg, and the suspected fractured hip was confirmed on X-ray. Lifetime risk for hip fracture is 6% in men and 14% in women. After reparative surgery, 40% of people will require living in a nursing home for at least a period of time during recovery, and 50% will permanently require a walker. The risk of death following hip fracture, even with the best of care, is about 10% at 1 month and up to 40% at 1 year. In 2011, hip fractures resulted in about 30% of all U.S. hospitalizations, costing about $5 billion, an untold amount of suffering. Prior to the development of surgical repair for hip fracture, treatment involved 6 weeks of traction and bed rest, with something like an 80% death rate from clots or pneumonia. Pinning the hip with ivory pins was first tried in 1899, but it was in World War II that a German surgeon began regularly using metal rods to stabilize bone fractures. From that point on, hip pinning became popular, allowing patients to stand up and start walking within days of surgery, remarkably reducing death rate following hip surgery. Presently, the surgical repair of a fractured hip involves a new artificial ball and sometimes socket, replacing the fractured hip in about a third of the cases. Pinning still works in most cases, however, and is quicker, easier, cheaper, and sometimes safer than the more invasive total hip surgery. 90% of hip fractures happen after falling, most often the result of inactivity and poor physical conditioning. Say it again. Inactivity is the most powerful risk factor for hip fracture. Although advanced age, poor eyesight, blood pressure medicines, soft bones, neurologic and cardiac conditions are also risk factors, the big danger comes from a lifetime of inactivity. So physical activity and conditioning at any age hardens bones, enhances strength, helps avoid falls and fractured hips. So unless you want to end up on a cold linoleum floor someday, get out and get walking.